Hello everyone, today we are giving a short introduction to gout. Gout is a type of inflammatory arthritis characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in the joints. Gout usually affects the big toe, but it can occur in any joint in feet, ankle, wrists, or knees. Gout occurs due to elevated levels of uric acid in the blood. Uric acid is a chemical that can lead to crystals forming around your joints which cause pain. The condition characterized by high uric acid levels is termed hyperuricemia. The causes of hyperuricemia are varied and complex. It is commonly seen in the elderly population. Being overweight and consuming alcohol are known to increase urate concentration. Other contributing factors include high cholesterol and high blood pressure. Certain medications, such as diuretics and ACE inhibitors, are also known to precipitate this condition. Additionally, consuming high purine foods, such as red meat, sugary beverages, and certain seafood, can increase urate levels. These urate crystals accumulate in your joints, causing inflammation and intense pain, triggering a gout attack. These crystals, also called tophi, are characteristic nodular masses found in the soft tissue surrounding the affected areas. This shows the complete circle of gout. There are two key approaches in managing gout: addressing acute attacks and implementing long-term control strategies. Okay, what is an acute attack? How would you characterize it? This phase involves managing sudden flare-ups of gout, characterized by intense pain in the affected joint, which is often followed by inflammation and redness in the affected area. This causes swelling in and around the affected joint. A patient may also notice nodules under the skin around the affected areas. These acute attacks can last for 1 to 2 weeks if left untreated. If a patient is experiencing such acute attack multiple times, or if there are large crystal deposits, or the gouty arthritis is chronic, then a patient is considered for long-term control of gout. Long-term control is simply a therapy to reduce urate concentration. As we have already discussed, gout is precipitated as a result of high urate level. The target level may differ based on patient's comorbidity and medication. However, generally the target serum level to control gout is 360 micromole per liter. If a patient is experiencing an acute attack, the question is whether it would be suitable for them to start on long-term control. As we will see in later slides, drug treatments for acute attacks and long-term control differ. Therefore, it is generally recommended to initiate long-term treatment at least 2 to 4 weeks after the acute attack subsides. However, if flares are frequent, urate-lowering long-term therapy can be started during a flare. Acute attacks are treated with a course of NSAIDs, with ibuprofen and naproxen being the most common options. Corticosteroids are another treatment option if NSAIDs are not sufficient. Corticosteroids can be taken orally or injected directly into the joint. Colchicine, a narrow therapeutic index drug, is also prescribed for acute gout attacks and is particularly suitable for patients for whom NSAIDs or corticosteroids are contraindicated, such as those at risk of bleeding. Lastly, the monoclonal antibody canakinumab may be prescribed if NSAIDs, corticosteroids, or colchicine fail or are considered unsuitable for treating acute attacks. Long-term control medications are taken prophylactically. Xanthine oxidase inhibitors, such as allopurinol and febuxostat, are commonly prescribed. These drugs reduce the formation of uric acid from purines and may take several weeks to months before their full benefits are seen. For individuals who are intolerant of xanthine oxidase inhibitors, a uricosuric drug such as sulfonpyrazone can be prescribed. Uricosuric drugs primarily exert their anti-gout effect by increasing the excretion of uric acid in the urine. Thank you for listening. Brought to you by That Green Pen.